She said, he needs to go to the emergency room and you need to go right now.
I could have a stroke on the table.
I think Andy and Janelle thought he might not make it home again.
It was just horrible seeing her like that.
He was just kicking and screaming and just freaking out.
I just felt like I was going to lose her.
Next, two medical mysteries that defied the experts. Daisy Hill is living a seemingly ordinary life until it's turned completely upside down by a bizarre lump on her neck that just won't stop growing.
David was holding me on his knees, crying, pleading with me to go to the doctor.
Then, nothing could have prepared little Tyler Berchielli and his family for the harrowing bouts of stomach pain that would leave him looking almost disfigured.
Tyler reminded me of a third-world malnourished child with a big, distended abdomen.
In the elevator, Tyler asked a question. Are they gonna cut me open with a knife? And at that point, my heart just stopped.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the winter of 1990, 41-year-old Daisy Hill was focused on one thing: staying in shape.
I did biathlons. I did races every weekend. I was very athletic.
I mean, you should have seen. Huh? She had some kind of body.
And when she hears about a local bodybuilding competition near her hometown, Houston, Texas, her training goes into high gear.
Daisy is a go-getter. When she puts her mind to something, she's going to do it. She's just that kind of a woman.
Then one morning, as she's checking out her appearance in the mirror, Daisy notices something very strange on the right side of her neck.
I had about 2 months before the contest, and I felt kind of felt like a soft pea in my neck and my jaw.
At first, she doesn't give it much thought. But shortly after the competition is over, the pea-sized lump begins to disturb her.
After a couple of months went by, I began to get a little bit of shooting pains in my jaw and thought I needed to maybe get it checked out.
She meets with her doctor, who gives her a thorough head-to-toe exam. And 45 minutes later, he's confident that it's nothing to lose any sleep over.
He said he thought it was just a swollen lymph node and that maybe I shouldn't worry about it. And he decided to try a round of antibiotics.
Over the next few weeks, Daisy diligently takes the medication. But the lump still seems to be getting bigger. She soon begins to wonder if it's something far more serious than a swollen lymph node. Her next appointment is with an ear, nose, and throat specialist.
He put a scope down my throat and kind of looked around, and he, said he thought I had some sort of maybe a mass or something, and that he suggested I see an oncologist. At that point, I became frantic.
The last thing she had ever imagined was that she might have cancer. Daisy immediately checks in with the oncologist, who quickly allays her fears.
He felt sure by just feeling of it that it wasn't cancer, but that there was possibly some sort of a mass or something that probably needed to come out.
He tells her that she has a benign tumor on her parotid gland, the largest of the salivary glands in the face. And the standard treatment is surgical removal of the gland.
Well, I was getting pretty scared and confused because it just really wasn't something I wanted to do.
I was alarmed, but I can't alarm Daisy because Daisy is terrified of doctors.
And she has good reason to be anxious. In 1972, her son Ronnie was born with disabilities that Daisy to this day attributes to second-rate medical care she received during her pregnancy.
It just left a bad scar in her mind and in her heart to try and believe in other people that were doctors and that were supposed to help people.
But despite her past experience, Daisy decides to give this new doctor the benefit of the doubt. He walks her through the very standard procedure and assures her that surgery is the only way to guarantee that the tumor won't spread.
I didn't have a lot of experience with doctors, and I just felt like it was going to be a pretty common procedure.
As she's wheeled into the OR, Daisy struggles to keep it together and just keeps telling herself to trust the medical team. 8 hours later, the doctor pronounces the surgery a success.
When I come out of the surgery and back in my room, I'm thinking everything's okay because my eyes feel like they're blinking.
But the next day, as the nurse is changing her bandages, she instantly comes to a terrifying realization.
My lip is drooping, my eye is drooping. This eye is blinking, but this eye is not.
In fact, the right side of Daisy's face is totally paralyzed.
I was just horrified. I just began to cry.
Almost as soon as an oncologist discovered a benign tumor on Daisy Hill's salivary gland, it was removed. Now, just a day after the surgery, her entire face is paralyzed.
I was panic-stricken.
Daisy looks like a stroke victim. She couldn't talk. It was just horrible seeing her like that.
That's pretty frightening. You've got to be just terrified.
As soon as he hears about Daisy's complications, the surgeon races down to her room. He quickly explains that in some cases, surgery on the salivary gland can damage the facial nerves. But he assures her that in time, the nerves will heal.
The doctor said the paralysis should go away in a few months.
In the meantime, the simplest tasks become a huge challenge for her.
Eating was very difficult. I could put food on one side and it came right back out this side.
But Daisy is determined to fight the paralysis head-on and works hard to regain control of both her speech and ability to swallow.
I constantly was working in the mirror to try to get facial expression. Just had to wait and hope that it would wear off and I would get it all back again.
It's a slow road to recovery, but nearly 6 months after the surgery, Daisy is finally feeling like her old self. Until one day, as she's grabbing a quick bite on the road, something truly bizarre happens.
All of a sudden, this liquid started pouring out of my face, my hairline, along the jaw, and began to wet my hair. And I just was terrified. I had what is this?
Daisy hightails it to the surgeon's office, but nothing could have prepared her for his diagnosis.
They explained to me that this was Fry's syndrome, something that occasionally happens when they take out the parotid gland.
When the surgeon removed the tumor on her salivary gland, not only were her facial nerves temporarily damaged, they were also rewired. In other words, the nerves that control the sweat glands and the salivary glands switched course. Now, instead of salivating when she's hungry or eating, she will begin to sweat profusely.
It changed my life as far as any social gatherings or going to eat at other people's homes.
She always had to have a napkin because it would soak her hair. I mean, it would literally pour out of her neck.
It wasn't anything that was going to go away. I was going to have to live with it.
And just when she thinks it can't get any worse, Daisy notices something even more alarming.
I started feeling like I still had this lump in my neck.
Whatever was in her throat was still there.
Despite all that she's been through, Daisy forces herself to go back to the surgeon.
He reassured me that there was nothing there, that he had removed the parotid gland, and there was no lump, nothing for me to worry about.
She does her best to accept the doctor's diagnosis. But as the weeks go by, she can't shake the feeling that the lump is still there. Daisy returns to see him 7 more times over the next 18 months.
Well, he just kept saying there's nothing there, and that I just needed to understand there was nothing there and everything was okay.
She kept going back, and it was like she was being a pain in the rear end to them. They felt they got it to go away.
And so I left there completely confused and having absolutely no faith in doctors at that point.
At the end of her rope, Daisy finally swears off conventional medicine altogether.
I have whatever this is in my neck. I have Fry's syndrome. My jaw is leaking. My face has been paralyzed. If it's not gone and I've gone through all this, what else would I have to go through? So maybe I could just live with this.
She had it in her mind that there was no doctor that really could help her.
Weeks turn into months, months turn into years, and nothing much changes except for the growth in Daisy's neck. To the shock of her friends and family, the once pea-sized lump slowly swells to the size of a grapefruit.
It was growing, but slowly. And so I thought I had control of whatever this was. And I just began to almost go into a denial mode, I think.
I knew she needed a specialist to look at it and to at least give her an idea or a choice rather than just not knowing anything.
But still terrified from her ordeal, Daisy prefers to manage the strange growth in her own way.
My hair was always a little bit long, but I began to grow it really long, and I would comb it over and cover it so that people wouldn't notice it because I didn't want to focus on it.
People didn't even know it was there, and it was huge. She was making it not exist to other people. It always existed to Daisy. Every morning when she looked in the mirror.
Daisy soon adopts a highly unorthodox approach to coping with the growth.
I decided that maybe if I named the tumor, I could embrace it and maybe it could become part of the family. So I decided to name it Big Bertha. That's kind of strange, but that's what I did.
Daisy does her best to pretend everything is okay. But she still refuses to go to the doctor. She can't bear the thought of another medical professional just blowing her off.
I don't think a lot of people can understand the fear that she had, but I did. And I stood by her, and I watched it grow and grow and grow.
As Big Bertha seems to be taking on a life of her own, Daisy starts to notice that her neck is far more sensitive than it has ever been. Then, one night as she and David are making dinner, a box of aluminum foil falls from the pantry shelf.
The box happened to hit me right on the tumor, and I just fell to my knees. I've never had pain like that. It was unbearable.
Of course, I was just trying to comfort her in any way that I could, but whatever I did just didn't take the pain away at all.
David was holding me on his knees, crying, and asking me, please, please, pleading with me to go to the doctor.
I just felt like I was going to lose her.
Petrified of doctors, Daisy Hill has refused to deal with a disfiguring tumor that has been growing in her neck for more than 15 years. But now, it's causing her so much pain that she can't ignore it any longer.
She was terrified of anybody touching her neck or even that side of her face.
When someone would go to hug me, I would find myself turning my head to keep anyone from hitting it. This tumor is now taking over my life.
After nearly a decade and a half without so much as a checkup, she finally makes an appointment with a facial, plastic, and reconstructive surgeon, Dr. Eugene Alford.
I was sitting there waiting for him to come in, and I was panic-stricken. I just couldn't believe I was in a doctor's office. I couldn't believe that somebody was going to look at this. And he was so sweet, and he at first looked at me and was surprised about where's the tumor.
She pulled her hair back and revealed this very large mass in her neck that went from just below her ear and the side of her jaw all the way down to her collarbones. It was enormous, to say the least, much bigger than a softball when I saw her the first time. It's very uncommon to see someone with a tumor this large. You're immediately struck by how could someone live with this?
Dr. Alford begins giving his anxious patient an extremely thorough exam, and almost immediately he quells Daisy's greatest fear. The growth is not cancerous.
I knew that, number one, the tumor was benign because it had been there for more than 10 years, and she was still alive.
But now he has to figure out just what's causing this growth in the first place. Dr. Alford orders an MRI so he can get a clearer sense of exactly how big it is and pinpoint its location inside her neck.
I told her I didn't know if we could take it out or not. It may be something she would choose to live with.
2 hours later, the MRI results are in, and the news is not good.
This is a tumor which is occurring in the deep space of the neck, called the parapharyngeal space.
This is a challenging space for doctors to examine, as all of the major blood vessels and nerves in the neck run through it. To make matters worse, it's clear to Dr. Alford that Daisy's tumor has grown around her carotid artery.
That's the main artery that supplies blood to the brain. We knew that the tumor's center had derived from the junction of the internal and external carotid arteries, that this was a highly vascular tumor, and so it gave us a diagnosis. She had a benign paraganglioma.
Paragangliomas are rare tumors that only grow near the adrenal glands in the abdomen and certain blood vessels or nerves in the head and neck. They're derived from very specialized nerve cells called paraganglia that monitor and help control blood pressure and breathing. It's unknown why these cells suddenly mutate and grow abnormally, but in Daisy's case, the mystery is even more profound.
Paragangliomas in and of themselves are very rare. Most of the ones we see are the size of a pecan, a walnut, maybe a big one the size of a baseball. Never seen one bigger than a softball, and that was extremely unique. I'm sure it's one in a lifetime.
But actually, Dr. Alford considers her lucky to have so few problems with a growth of this size.
One of the key things about paragangliomas is they grow slowly. And when changes occur slowly over time, the body can accommodate to them.
That's why Daisy didn't have more difficulty swallowing and breathing. Her body simply learned to live with the huge growth. With a diagnosis in hand, Dr. Alford begins considering the next step. He can surgically remove the enormous tumor, but the operation is highly complex and decidedly risky.
This was going to be a very difficult surgery in that we were going to have to resect the internal and external carotid arteries. We had to find out if, number one, by removing this tumor, would she bleed to death, or would she have a stroke and not survive the surgical procedure itself?
I'm just trying to soak it all in, and I'm terrified. I can't even believe this is happening to me. I could have a stroke now, I could have a stroke on the table, I could bleed to death. This is a serious surgery.
As Daisy's world begins to spiral out of control, Dr. Alford drops another bombshell. In order to get to the tumor, he will need to sever the nerves that control her speech and swallowing. Even if she survives the surgery, Daisy will have to go through an intense rehabilitation.
Well, I think all of a sudden I became kind of numb. I was terrified. I cried and cried and cried.
But Dr. Alford makes it clear that he doesn't think Daisy has any choice but to go through with the dangerous surgery. If she doesn't have it removed, it will most certainly kill her.
They just get so big that they outgrow their own blood supply, and they die from the inside out. And when they die like that, it causes the blood vessels to rupture and patients bleed to death. It is a very unpleasant way in which to leave this earth.
But before Daisy makes a decision on another surgery, she has one critical question. Why wasn't this caught so many years earlier, when her parotid gland was erroneously removed?
I think it's just a lack of understanding of anatomy, perhaps taking the easiest answer. When you have a hammer, everything looks like a nail. And apparently this other physician had a hammer, but didn't have the other tools you really need to make the right diagnosis.
Deep down inside, I really wasn't sure that she was going to go for it. We had her right there at the edge, but we just knew we couldn't push her over it.
I wanted to run away, just leave. I didn't want to do it, but Dr. Alford said it had to be done.
She really didn't have a choice. It was sort of like, okay, how long do I live with this ticking time bomb before it kills me?
For almost 16 years, Daisy Hill watched a seemingly benign tumor grow on the side of her neck. But nothing could have prepared her for the situation she's in now. Her doctor has just told her that her life is literally on the line. If she lets the softball-sized tumor be, it could rupture and she could bleed to death. If she has it removed, Daisy may not survive the extremely dangerous surgery.
I knew that my loved ones wanted me here, and I knew I would die. if I didn't have the surgery.
You know, it took a lot of bravery on her part to make that difficult decision because there wasn't an obvious, easy, good choice.
On the morning of her surgery, Daisy bravely says goodbye to those who love her most.
I wasn't really sure if I would come out in one piece or be a vegetable or even make it out at all.
As she's wheeled in for the 8-hour surgery, David and Melanie struggle to keep it together.
When she went in, I didn't think she was going to come back out. I really didn't.
As the hours go by, they anxiously wait for some news from Dr. Alford.
We went into the procedure with a fair amount of trepidation. Oftentimes when tumors have been there for so long, they're really stuck to surrounding tissues and grown into things and really invasive.
But Dr. Alford's tumor removal is going like a textbook case.
There was very little blood loss during her surgery. That allowed Dr. Reardon and I to control the carotid artery at the base of the skull, then dissect out the external carotid artery and remove the tumor in one piece. It was spectacular. It was a lot of fun.
Dr. Alford closes Daisy up 4 hours sooner than he expected and heads out to give David and Melanie the good news.
The best part was there'd been no stroke, no vascular compromise, no brain damage, and we really anticipated she would be just fine.
The moment I woke up, the pain was gone. And it was just unbelievable. I asked Dr. Alford, you know, where's the pain? I have no pain.
And I said, because the tumor is gone, and that's the way it should be. That's the way it's supposed to be.
And we knew she was on her way to feeling much, much better.
While the surgery was a success, it did cause permanent damage to the nerves that control Daisy's ability to swallow. Today, just 17 months later, she can swallow some soft foods, but she relies on shakes packed with nutrients to help maintain a healthy diet.
I can get my vitamins and minerals that way, and that's what I drink every day of my life.
Daisy learned so much over the course of her 15-year ordeal. But if there's one thing the experience has taught her, it's the importance of sticking to your guns, even when no one takes you seriously.
If you think something's wrong and you're not happy with the doctor that you have, then just go to someone that you can't be happy with, because there are some out there that are very good. Life without Big Bertha now is wonderful. I don't miss her. I think about her a lot, and I look at some of the pictures and I just can't believe it's gone.
While Daisy Hill waited to get medical help until it was almost too late, young Tyler Berchielli's parents spent almost his entire life going from one doctor to another, desperate to find out what was causing his terrifying symptoms. By midsummer of 2002, Janelle and Andy Berchielli had been trying to conceive their first child together for almost 2 years.
We finally just gave up and said, I guess we're not meant to have any children, and we'll just let nature take its course, and if it happens, it happens.
The young couple remains hopeful, but in the meantime, they're content to focus all of their energy on raising 8-year-old Isabella, Janelle's daughter from a previous marriage. Then, 3 months later, on a whim, Janelle takes a pregnancy test.
It came up positive, so it was like, okay, I'm pregnant. Oh my gosh, I'm pregnant.
She's like, guess what? I was really excited because for me, it'd be my first time going through the whole baby experience.
On June 28, 2003, 7-pound, 3-ounce Tyler Berchielli is born.
He was perfect in every way. He had 10 fingers, 10 toes, you know. It just a perfect little angel.
When Tyler turns 6 months old, Janelle introduces him to solid foods, just like she did with her daughter. But she isn't prepared for his reaction.
He didn't really take it that great. He didn't eat it that well, but, you know, he kind of got a little bit down.
2 weeks later, she is alarmed when she realizes that her son hasn't had a bowel movement in days.
And then it continued on to a couple days, turned into a week of no bowel movement.
The experienced mother is now sure that something is very wrong with her son.
You could tell that there was a level of pain there, but he was pretty good at hiding it.
She immediately takes Tyler in to see the family pediatrician.
She felt Tyler's tummy, and she said, it feels a little firm, but, nothing's really wrong with it.
The doctor assures her that breastfed babies often experience a little constipation when they transition to solid foods. She prescribes a gentle laxative and instructs Janelle to give it to him once a day. Relieved that there is nothing seriously wrong, she diligently follows the doctor's orders.
I did what she told me to because she's the doctor.
They give Tyler the laxative as instructed, but he just seems to be getting more uncomfortable.
He was crying a lot in pain. It just didn't seem right to me.
As time went on, I became more and more aware that something was definitely wrong.
Then, along with Tyler's stomach pain, comes a shocking new symptom.
It's like his belly never went down to a flat little belly. He always had a little pot belly.
I was starting to get worried if that was causing any damage to him, not having a bowel movement for 2 weeks.
Over the next 12 months, Janelle takes her son to a series of doctors, but over and over she's told the same thing. Tyler's bouts of constipation are normal.
Tyler was miserable, as you can imagine. We knew that there was something wrong with him, but the doctors were not helpful.
One doctor even theorizes that all of Tyler's problems are in fact psychological.
He said that it's quite possible that one time that Tyler went to the bathroom and it hurt, and so then he just decided that I don't like that hurt feeling and I'm just gonna hold it back.
That was so ridiculous. I just couldn't believe that anybody would say something like that.
As their frustration with the medical experts mounts, the Berchiellis decide to take matters into their own hands.
I felt like I couldn't trust any doctor.
They just kept throwing answers at us and nothing really seemed to stick.
Janelle soon begins experimenting with a variety of home remedies, from fruit juices to homemade muffins to infant massage. But despite all her efforts, Tyler is still only having a bowel movement once a month.
You feel sad, you feel bad for him, you feel like you should do something to relieve his pain or do something to make him more comfortable.
Then, just before Tyler's second birthday, Janelle notices a terrifying new symptom.
One day, his little tummy just seemed more bloated than normally, and it just was really, really hard, almost as hard as a rock, and I just knew something wasn't right.
That was very scary. This little guy was so sick, and he was so miserable.
Janelle packs Tyler into the car and races him to the pediatrician's office. As soon as she feels Tyler's abdomen, the doctor orders an X-ray. For the first time in a year and a half, she seems to be taking Janelle's concerns seriously.
The doctor comes back into the exam room and brings the X-ray with her and shows me that there is a blockage.
The doctor's concerned that if they don't remove whatever is blocking Tyler's intestines immediately, a severe infection could develop.
I was pretty scared because she was really serious about this. It needed to get removed.
Willing to try anything at this point, the Berchiellis agree to let the doctor administer a powerful medication through an NG tube, a plastic hose that goes through Tyler's nose and down into his stomach.
They didn't sedate him. I can't imagine them doing that for a little boy.
Judy and I had to physically hold him down because he was just kicking and screaming and just freaking out. He had never done anything like this before, so it was very traumatic for him.
After 2 excruciating hours, it's clear the medication isn't doing the trick. Tyler is still blocked up, so the pediatrician orders a series of enemas.
One nurse was doing an enema, and the other nurse was also helping hold him down as well. And they basically kept coming back in to do this like every 20 minutes, over and over and over again.
Over the next 3 hours, Tyler endures 4 enemas during each hour, all in conjunction with the potent medication being pumped through the NG tube. And still, the blockage isn't budging. Janelle and Judy can't quite believe what's going on, but they're struggling to keep it together for Tyler's sake.
He was fighting us for all he was worth. It was a miserable experience. It was like torture.
In the past 18 months, 2-year-old Tyler Berchielli has had less than 20 bowel movements.
We've had Tyler on every prayer list that we've known about. People all over the country praying for him, this thing and that thing.
Every doctor he's been to has assured his parents that he's simply constipated and will eventually start going to the bathroom on a regular basis. But when the family physician takes an X-ray of his abdomen, it's clear that almost his entire colon is blocked. She's now ordered an intense round of enemas to help flush out his system.
I felt horrible. I felt like we were torturing him. Here we are, we've got this little boy who's not even 2 yet, going through this horrible, horrible experience.
After watching her son suffer through more than a dozen unsuccessful enemas, Janelle can't take it anymore.
I'm his only advocate. I need to be his voice. He's 2 years old, he's still a baby.
Even though the doctor is confident that the procedure will eventually help Tyler pass the blockage, his mother and grandmother insist on calling the whole thing off.
We just said, this is enough.
We shouldn't have allowed them to put him through so much pain. The thing is, at the time, you assume that the doctor knows what she's doing.
Janelle does all that she can to help Tyler recover from the nightmarish experience. And when he finally goes to the bathroom 2 days later, the Berchiellis breathe a huge sigh of relief.
I can see the light now at the end of the tunnel here. I was really hopeful that, very shortly we were going to be able to fix this problem.
But just when they think everything is okay, the chronic constipation returns with a vengeance.
The pattern started all over again. First it was a week with no bowel movement, and then it was 2 weeks, and then it was 3 weeks.
Oh, poor little guy. You could tell that he was miserable. He would double over in pain. His abdomen would get so distended, it just looked like it might explode. It was very frightening sometimes.
Desperate to help her son, Janelle tracks down a pediatric gastroenterologist and walks her through Tyler's entire medical history.
She said that we're going to get to the bottom of this. We're going to figure this out. I just was really hopeful that she was going to be able to help us.
Determined to solve the case, the doctor admits Tyler to the hospital so that she can run a series of tests, including an endoscopy, which will allow her to get a detailed look at his large intestine.
We were real hopeful that, this is it. These tests are going to come back and they're going to tell us what is wrong, and we're going to know what the answer is.
But 2 weeks later, when the test results come in, they're nothing short of shocking. Everything appears to be normal. Completely baffled, the doctor tells the Berchiellis that the only thing they can do now is wait and see what happens next. And sure enough, a week later, the crippling constipation sets in again.
Before it was more gradual. This time it was like within a week. We were huge, rock hard belly. He was in a lot of pain. He was crying. He wasn't eating.
Tyler sometimes reminded me of a third world malnourished child with a big distended abdomen and the skinny little arms and legs.
He was just even more sick than we had ever seen him in his life.
I think that Tyler couldn't understand why we as his family, the adults in his life, couldn't fix him, make him feel better. So that makes you feel like you're failing your child. I can't imagine how difficult that was for Janelle.
Beside herself, Janelle takes Tyler back to the pediatric gastroenterologist. As soon as she hears how quickly Tyler is deteriorating, she performs a water-soluble contrast enema test. A radiopaque dye is introduced into Tyler's colon, enabling her to take an X-ray of his large intestine. An hour later, the Berchiellis head home to wait for the results. But almost as soon as they walk in the door, Tyler takes a turn for the worse.
Tyler just started throwing up. And he just kept throwing up, and he just wouldn't stop.
Janelle immediately picks up the phone and makes a frantic call to the doctor.
She said, he needs to go to the emergency room, and you need to go right now.
Four-year-old Tyler Berchielli hasn't had a bowel movement in the last month. And when his doctor administers a highly specialized enema in an attempt to find out why, the fragile young boy starts to vomit uncontrollably. Now his parents are rushing him to the emergency room.
We had a little bucket for him to throw up in. Andy drove to the hospital. I sat in the back seat with Tyler and helped him.
I think Andy and Janelle thought he might not make it home again. They were very, very frightened.
After giving Tyler a medication to control the violent vomiting, the ER doctors turn their attention to the real problem, his blocked colon. They call in pediatric surgeon Dr. Robert Gates to take over the case.
You look at these children and they are obviously helpless. They are in extreme discomfort. Tyler was breathing rapidly simply because his abdomen was so distended.
First, he orders a series of x-rays to find out exactly what he's dealing with. And as soon as he sees the images, it's clear that the little boy's intestines are severely impacted.
We proceeded to irrigate his colon in the emergency department. I was able to remove about 1.5 gallons of material from his colon. This is quite a bit of fluid to be retained in the colon of anybody, let alone a 4-year-old child.
After the irrigation flush, you could really tell his stomach went down. Like, it was the flattest we've seen it since he was born, basically. It was really amazing to see.
I told his parents that I was suspecting a number of different possibilities, but that he needed to be admitted to the hospital until I was 100% sure of this diagnosis.
Tyler was very stressed. He knew we were going to do something, but he wasn't sure what we were going to do.
As soon as Tyler is admitted, Dr. Gates walks the family through the next step in his investigation. He needs to perform a rectal biopsy, a surgical procedure that will take about an hour.
We irrigate the rectum and then take small samples of the rectal mucosa, and by analyzing that, we can determine whether or not there are abnormalities.
I'm kind of scared for him to have to go through a surgery. And we were very hopeful that we're going to find an answer to what was going on.
Everyone is anxious to know what the biopsy will reveal. And when the findings are in, Dr. Gates knows right away that he's found the critical clue he's been looking for.
The results showed that the child did not have ganglion cells in the wall of the rectum, which is diagnostic of Hirschsprung's disease.
Hirschsprung's disease occurs when nerve cells in the large intestine, called ganglion cells, don't form during fetal development. In a healthy individual, these nerve cells instruct the muscles in the colon to eliminate waste when it's full. But patients like Tyler don't have ganglion cells, so rather than passing through the colon, the stool simply stops moving, and over time begins to build up.
It would be like you have power lines running outside up and down the street, but you didn't connect the power line to your house, so the appliances are not going to work. And that's in essence what has happened with Tyler, is that he lacks the ability of the very end of his rectum to contract, and so everything else kind of backs up before that.
We were totally floored. None of us had ever heard of that disease before.
It was just a sigh of relief, actually, to know that they found an answer that we've been looking for the past 4 years.
But the news is bittersweet. Tyler will need to undergo an extensive round of invasive surgeries to help his colon function normally.
The way to treat Hirschsprung's is to surgically remove that segment of colon that does not function, the segment of colon that does not have the ganglion cells.
You're worried that your son's going to go through surgery. You know, it's like, wow, it's really hard to deal with everything all at once like that.
But left untreated, Tyler's life could be on the line.
The dangers of Hirschsprung's are malnutrition, perforation of the intestine, development of the enterocolitis, a severe overwhelming infection of the intestine that can result in death.
Assuming the surgery is successful, Tyler will also need to wear a colostomy bag for several months.
His colon was so dilated that we were going to have to resect a segment of that dilated colon and give him a colostomy.
The colostomy will connect Tyler's enlarged colon to a surgical opening in his abdominal wall. Until his colon heals, his stool will collect in a small bag on his side.
We were, kind of nervous and not sure if a colostomy was something we could care for, but, finally we had an answer and Tyler could go on and live a normal life after this.
On January 24th, 2008, they wheel Tyler to the operating room. Janelle struggles to keep a brave face on for her little boy.
In the elevator, Tyler asked a question. Are they going to cut me open with a knife? And at that point, my heart just stopped. I was just like, he understands. And I just didn't know what to say to him. All my emotions came and I just tried to hold it together for him.
You don't want to show any fear to your son to know that he's going to go through something like that.
All Janelle and Andy can do now is wait. Four hours later, after Dr. Gates has removed 25% of Tyler's lower intestine, he pronounces the surgery a success.
He said things went really well and, we could probably go home in a few more days after recovery.
Over the next few weeks, the Berchiellis couldn't be more relieved as they watched Tyler regain his strength. Still, they can't help but wonder why it took more than 4 years for someone to figure out what was plaguing their son.
A pediatrician will see so many different patients with so many different issues, and they look for common things. One analogy would be if you go to a horse farm, you expect to see horses. You don't expect to see zebras and giraffes. And that's what Hirschsprung's disease is, essentially, is a zebra in the middle of a horse farm.
Not every doctor knows everything, so you have to keep searching and just don't give up.
Making it even more difficult to diagnose was the fact that Tyler's case is less severe than many children with Hirschsprung's. It is most commonly diagnosed in newborns who are unable to pass any waste at all during the first days of their lives.
With Tyler, he was able to pass some stool. He still was able to grow and develop and did not exhibit the striking signs of Hirschsprung's that we'd see until the last several months.
Today, Tyler has regular bowel movements with the help of his colostomy bag.
He's definitely got used to having the colostomy on him. He doesn't want us touching it at all. That's his job. His job is to remove the colostomy.
It was much easier than I thought it was going to be, just as easy as it is to change a baby's diaper.
After 2 more surgeries, Tyler will be able to start using a toilet for the first time in his life. And despite the fact that he still has a long way to go, the Berchiellis remain inspired by their young son's courage.
Even when he was as sick as I've ever seen him, I knew that he would pull through because this was the baby that we had wanted for so long, and he was strong and he was a fighter and he wasn't going to give up.